President Trump's warning to pregnant women this week to stop taking Tylenol based on his unproven claim that it can lead to autism sparked widespread concern and many questions about what the science actually shows. So we're going to try to take some time and answer some of those questions. Let's start with Tylenol, which doctors have turned to as the best option for treating pain and fever during pregnancy. On Monday, President Trump blamed acetaminophen in part for a significant rise in the number of cases of autism. Here's what he said.
Acetaminophen, which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. I want to say it like it is. Don't take Tylenol. Don't take it. If you just can't, I mean, it's fight like hell not to take it. There may be a point where you have to, and that you have to work out with yourself.
For more on this, we're joined first by Dr. Linda Eckert. She's an author and a professor of obstetrics and gynecology at the University of Washington. Dr. Eckert, welcome to the NewsHour. Thanks for joining us.
Well, thank you.
So scientists have been looking at this link between acetaminophen and autism for decades. In the announcement, we should point out that the White House leaned very heavily on the research of the dean of Harvard School of Public Health, Dr. Andrea Beccarelli, quoting him as saying there is a causal relationship between Tylenol and autism. Just tell us, what does most of the research on this issue show?
Most of the research does not bear out that there's a causal relationship. Causal relationships are quite hard to prove, actually. And the research on Tylenol has been quite reassuring overall. And there was actually many studies, several great studies that have looked at this. And the most recent one that is a very powerful study was done in Sweden, where they looked over 250,000 individuals. And they also were able to look at siblings, where people had environmental and sibling relationships, genetics in common. When they accounted for these environmental and genetic risks, they did not see any association between Tylenol and autism. So that's thought to be a very gold standard study.
Dr. Eckert, can I also ask you, the reporting has shown recently that Dr. Beccarelli was also paid some $150,000 a few years ago in 2023 to be an expert witness in a lawsuit against the makers of Tylenol. It's gotten a lot of attention, but is that unusual or cause for concern here?
Well, I feel like a lot of times when people do research and publish it, they are asked to be experts. I think what's important is to disclose that and also to have a balance of people that are testifying or offering expert opinions.
I want to ask you as well about what we just heard from the president, because he spoke very definitively about this. He said to pregnant women about Tylenol, just don't take it, fight like hell not to take it. How does that square from the guidance from professional medical associations?
It does not square well. The American College of Obstetrics and Gynecology, the Royal College of Obstetrics and Gynecology, the Society for Maternal Fetal Medicine, all have looked very extensively at the data. All have come out quite strongly, reaffirming their recommendations that Tylenol really is the best choice for controlling pain and fever in pregnancy, and both pain and fever in pregnancy themselves have risks for the fetus.
We also heard the president say to pregnant women that they should consider toughing it out when it comes to pain or fever during their pregnancies. We know pregnancy to be such a high-stress time for women already. I just wonder how you look at that language.
Well, I have to say, as someone who's cared for pregnant patients for over 30 years, I find it shocking. I think that it is unlikely that the same advice would be given to the opposite gender, to just bear their pain and not do anything about it. And the most important thing is that we want pregnant patients to be well and their babies to be well, just like they do. So I think they should talk to their providers, and they should use evidence-based medicine and science to help make that decision.
We also heard the Health Secretary Kennedy announce that his agency is closely examining links between vaccines and autism. And he said before that this kind of research has been actively suppressed in the past. Can I get your take on that? Is there any evidence that that research has been suppressed?
I think it's the opposite, actually. This has been looked at so carefully, And there are many studies, tens and tens of studies, a very large number of patients all over the world that have shown that there is not a link between autism and vaccine use.
If I can just ask you lastly here to speak directly to women who heard this advice this week and maybe are concerned about decisions they made while pregnant or decisions they're making now that they are pregnant, what would your message to them be?
I would offer reassurance and empathy, and I am sorry that this is such a confusing time with all of these mixed messages. I feel like there are good reasons to use Tylenol in the appropriate doses and consult with your physician. And I hope that you can feel good about taking the best care of yourself and your baby.
Dr. Linda Eckert, OBGYN faculty at the University of Washington. Dr. Eckert, thank you for joining us. We appreciate it.
Thank you so much.